Patient care process. Effective patient care follows a structured approach that includes assessment, intervention, monitoring, follow-up, and documentation. Each of these stages plays a critical role in ensuring optimal therapeutic outcomes and patient safety. Within pharmacy practice, delivering proper patient care requires the integration of several essential professional skills. One of the most important competencies involves prescription processing and dispensing, where the pharmacist evaluates whether the prescribed medication is appropriate for the patient's condition and overall health profile. In addition to this, pharmacists must demonstrate strong abilities in assessing a patient's health status through clinical judgment and available medical information. Another key responsibility is the identification of both actual and potential drug-related problems, DRPs, also referred to as drug therapy problems, DTPs. Alongside this, pharmacists must carefully evaluate the therapeutic appropriateness of medications, ensuring that each treatment aligns with current clinical guidelines and patient-specific factors. Developing and implementing a comprehensive therapeutic care plan is also a crucial component of pharmacy practice. This involves selecting the most suitable medications, determining proper dosages, and considering patient-specific needs. Furthermore, pharmacists must engage in continuous monitoring and follow-up, assessing patient progress and making necessary adjustments to therapy. Equally important is ensuring that patients clearly understand how to use their medications correctly, as proper usage directly influences treatment success. Finally, thorough documentation of all findings, interventions, and follow-ups is essential for maintaining continuity of care and effective communication among healthcare providers. Drug-related problems, DRPs/drug therapy problems, DTPs. Drug-related problems are defined as undesirable events associated with medication therapy that may interfere with achieving the intended therapeutic goals. These issues can arise at any stage of the medication use process, including prescribing, transcribing, dispensing, or administration. Categories of drug therapy problems. Drug therapy problems are generally classified into 7 major categories, each representing a different type of issue that may compromise patient care. 1. Unnecessary drug therapy, no valid indication. This situation occurs when a medication is prescribed without a proper clinical reason. For instance, prescribing antibiotics for a viral infection such as influenza is inappropriate. Similarly, using benzodiazepines for insomnia caused by lifestyle factors may not be justified, where non-pharmacological approaches like sleep hygiene would be more suitable. 2. Need for additional drug therapy. In some cases, a patient may require an additional medication to properly manage a condition or prevent complications. For example, an asthma patient frequently refilling salbutamol without a controller medication may need inhaled corticosteroids. Other examples include opioid-induced constipation requiring a laxative, methotrexate therapy needing folic acid supplementation, or isoniazid therapy requiring vitamin B6 to prevent neuropathy.
3. Ineffective drug therapy.
This category applies when the selected medication is not producing the desired therapeutic effect. It may involve choosing a less effective drug when a better option exists, or using a drug that is unsuitable for the condition. For example, confusing similar drug names such as Losec and Lasix can lead to ineffective treatment. 4. Dosage too low, subtherapeutic dose. A dosage may be insufficient if it does not achieve the minimum effective concentration. This can occur due to low dosing, infrequent administration, drug interactions, or short treatment duration. For example, prescribing amoxicillin at 250 mg instead of the standard 500 mg for adults may result in inadequate treatment. 5. Dosage too high. Excessive dosing can lead to toxicity and harmful effects. This may result from high doses, frequent administration, or interactions that increase drug levels. Rapid drug infusion can also contribute to this issue. 6. Adverse drug reactions, ADRs. Adverse reactions include side effects that may or may not be dose-related, allergic reactions, or complications arising from contraindications. For example, clindamycin may cause severe diarrhea due to Clostridioides difficile infection. 7. Non-adherence, non-compliance. Failure to take medications as prescribed can occur for several reasons, including unclear instructions, forgetfulness, difficulty swallowing, cost issues, or lack of belief in the medication's effectiveness. Clinical alerts, examples of DTPs. Certain clinical scenarios highlight common drug therapy problems encountered in practice. An elderly patient with reduced kidney function, creatine clearance 20 milliliters per minute, prescribed high-dose naproxen is at risk of adverse effects, making this an inappropriate drug choice. A patient taking multiple products containing acetaminophen may exceed the safe daily dose, resulting in a dosage too high problem. A child receiving a lower than recommended dose of amoxicillin represents a dosage too low issue. Taking levothyroxine with milk can reduce absorption, illustrating a drug-food interaction. Similarly, combining iron supplements with omeprazoles can decrease iron absorption. Using weight loss medication like liraglutide in a patient with a normal BMI represents unnecessary drug therapy. Deprescribing. Deprescribing refers to the planned and supervised process of reducing or discontinuing medications that are no longer beneficial or may be causing harm. Common drug classes targeted for deprescribing include proton pump inhibitors, PPIs, benzodiazepines, antipsychotics, and certain anti-hyperglycemic agents. Documentation and SOAP notes. Accurate documentation is a fundamental aspect of patient care, ensuring effective communication among healthcare professionals. One widely used method is the SOAP note format, which organizes clinical information systematically. Subjective S. This section includes information reported by the patient, such as symptoms, medical history, and medication use. For example, a patient may report ongoing hypertension despite current treatment. Objective O. Objective data consists of measurable findings such as vital signs, laboratory results, and diagnostic tests. These may include blood pressure readings, serum creatinine levels, and blood glucose measurements. Assessment A. In this stage, the pharmacist evaluates the patient's condition, identifies problems, and determines whether therapy is effective or requires modification. Plan P. The final component involves developing a treatment plan, which may include medication adjustments, patient counseling, monitoring strategies, and follow-up arrangements. Clinical assessment tools. Various clinical tools assist healthcare professionals in evaluating patient risk and guiding treatment decisions. Examples include Framingham Risk Score for cardiovascular risk assessment, TIMI score for myocardial infarction, MMSE for cognitive function and dementia, CHA2-2 VASC for stroke risk in atrial fibrillation, has bled for bleeding risk, PSI for pneumonia severity, NYHA classification for heart failure, Apache 2 for ICU patient severity, Gold criteria for chronic obstructive pulmonary disease, COPD. Please subscribe, like and share.